Good morning, folks. Just want to briefly review numbers with you, and then I'll take your questions. As of this morning, there were 3,617 cumulative cases reported in Pitt County. That number will change at noontime when the state posts new numbers from their system. At this time, we have sadly had 19 deaths in Pitt County. If we use our deaths and our cases to calculate a case fatality rate, we come up with a case fatality rate of 0.5%. That is roughly 5 times the cumulative case fatality rate for influenza, which is generally reported as 0.1%. There is some good news in that. While sadly, a 0.5% of folks who get this die, at this point in Pitt County, 99.5% of those who have gotten COVID-19 have survived COVID-19. So perhaps there's a bit of good news in those numbers. The past couple of weeks, we've seen tremendous growth in our cases. That growth has been predominantly in the 18 to 24-year-old or college age group in Pitt County, and those cases now represent 38% of our total cases here in Pitt County. One of the other metrics that we've been following at the health department are what we would consider active cases and cases per 1,000 individuals in Pitt County. So if we take the total number of cases, cumulative cases, subtract our recovered number, and yesterday we estimated we had 2,269 individuals recovered in Pitt County, and then our deceased members, we come up with 1,329 cases that we consider active, meaning they are less than 15 days old. If we divide those by the approximate Pitt County population of 185,000, we come up with 7.2 cases per 1,000 individuals in Pitt County or Pitt County residents. Before the surge of cases with the opening of ECU, we were running about 3.1 to 3.4, so that has more than doubled with the influx of cases related to the reopening of ECU. I suspect it'll take us a couple of incubation cycles to roll through those cases at ECU before our numbers return to previous levels. Happy to take your questions at this time.
So the governor announced yesterday that we would kind of be moving into phase 2.5 of reopening. In your view, do you think this is best for the people here in Pitt County?
I think we've unofficially been into phase 2.5. People have been choosing to do things in defiance of the governor's order already. So some of the things that have been closed, like playgrounds, will reopen. Gyms, which were officially closed and open only to those with health conditions that required exercise, were allowed to be open. So I think capacity-wise, I think this will have little impact in our numbers. Playgrounds, early on, the concern was contact spread and maybe leaving this virus on playground equipment. We know now that the virus doesn't persist very long in the sunshine minutes, at most probably in these settings. There is still some concern about crowding in playgrounds where transmission could occur, but we really should think about predominantly close person-to-person contact for transmission and less about the contact with physical surfaces for transmission. So I don't see a huge impact from these changes in terms of our case numbers now.
And last week, you spoke, in a letter, you sent a letter to the Board of Education, giving your viewpoint about in-person versus virtual classes. The board voted to stick with the in-person option, despite maybe some of the guidance that you had suggested in that letter. Any response to that decision for them to continue with in-person classes?
Here's what I think is that it's my job to apprise the school board of what I see as the epidemiologic or disease picture in Pitt County. When I had met with them in July, we talked about a threshold of perhaps 10% to reconsider in-person instruction. In some of our, in the overall county percent positivity, we're about 14%. In our internal positivity, we had hit 17% on one day, again, mostly with some ECU students who were in our testing mix. And the on-campus testing, which has a much higher percentage depending on how the groups stack up, symptomatic versus asymptomatic. So I think the most prudent advice I could give the school board was to take a pause in face-to-face instruction. The school board has a duty to its students, faculty, and staff to choose the best course as it sees it for its students, faculty, and staff. And they chose what they saw as the best course for students, faculty, and staff. And I have no beef with them, but I think I had to give them the advice that I gave them to help them make a decision moving forward.
Have they seen any instances yet of, the words are escaping me, of passing the virus along within school?
Yeah, so the question is, have we seen transmission within the schools? And at this point, I'd still have to say no. While we have seen isolated cases in students and faculty and staff, we have yet to be able to clearly define that there's been transmission from a student to a student, or student to staff, or staff to student. So at this point, we think that these have all been brought in from the community and not within the school district itself. And so that's good news.
Yeah,
That's good news.
Does that make you breathe a little sigh of relief that it hasn't quite gotten to that point yet?
Yeah, I think absolutely. We're watching that closely. My communicable disease staff communicates several times a day with the school's monitoring staff. They have a internal monitoring program with the school nurses and some contract nurses and a coordinator to help us manage the contact identification and tracking in the school district, and that seems to be working very, very well.
So, well, Dr. Silvernail, thanks for taking some time for us today. Really appreciate that. And kind of sticking with the schools, from the first week of opening to the second week of opening, they saw, somewhat of a jump as far as the number of cases. Obviously, on 11 cases versus how many students and faculty and staff there are at Pitt County schools, it definitely shows a small number. But could you see that number continue to jump if the school board continues to keep face-to-face classes happening?
That's hard to say, Tyler. I think, we work closely with the school district to help them with their protective measures in school. They've done a great job with placing protective measures in school. They're screening students as they come in. Students are supposed to be screened at home as well. They have students spread out. Remember, on any given day, it was about 60-40, I think. 40% of students chose to be online only. 60% of students or families chose to be in person. So divide that in half on any given day, there's about 30% of the normal student load in Pitt County schools. So that certainly allows them to be spread out to maintain their social distancing. There are some issues with some children not being able to keep their masks on. And that's one of the things that we look at when there is a case. We try to, if we can clearly say that exposure is low risk or medium risk, then that allows a different course of response. If we cannot clearly say that it's a low risk or medium risk exposure, then we assume that that's a high risk exposure, and we take the most strict response to that, which means quarantining the exposed and getting them tested if they choose to be tested, or complete quarantine with those folks.
And I'm sure there has to be, some sort of significance, especially with this virus. We're seeing so many people with asymptomatic, not showing any symptoms, and that's something that obviously could pose a risk, especially for the school system. I know they're taking effective measures with masks and social distancing and whatnot. What would be kind of your message to families and the community members about still that possibility of spreading the virus if you don't even know you have it?
Yeah. Again, we come back to kind of the 3 W's, the wear, wait, and wash. Wearing masks, and I've got my mask here. I wear that when I'm in public. I wear it walking around our office. Anytime that I'm face to face with people outside of my immediate family, people need to do that so that if they are an asymptomatic case, they reduce the chances that they can give it to someone else. Maintaining that physical distancing, again, it's about close personal contact. We know that in general, respiratory droplets travel, 4 feet to maybe 6 feet. There are some reported instances of greater travel, but those are exceptions, not the typical. So being separated so that we can't transmit it over that space. And then hand sanitizing, because sometimes inadvertently the virus does get on our hands, and then if we touch our eyes, our nose, our mouth, we can potentially inoculate ourselves with that virus if it's on our hands. So sanitizing or washing our hands frequently helps. So those are good stopgaps in between to help with blocking transmission to yourself and to others.
We just learned less than 15 minutes ago that the school board is meeting Friday to consider adding another virtual day to their week. What would be your message to the school board if they came to you and asked your opinion if they should do this or not? What would you say? Tell them.
I'm not sure what you mean by adding a virtual day. Is that
So we just heard that, so the school board, they're meeting to essentially, based off of me just quickly reading the press release, is that they are going to be conducting a special board meeting to consider a recommendation to add 1 virtual day per week of face-to-face instruction and take any necessary action. So essentially, from what I understand based off that, they're going to consider to moving face-to-face day to a virtual day.
So maybe doing face-to-face 4 days a week instead of 5?
I think essentially
is that what it means?
converting one of those.
I guess I would support that. I don't understand it clearly, Tyler, so it's hard for me to to say exactly what it means, and they have not discussed that with me, but anytime people aren't together, the risk of transmission goes down. So if moving to a 4-day face-to-face schedule is something they're considering, I certainly would support that.
Gotcha. And kind of switching gears, can we talk a little bit about the contact tracing and kind of, what kind of response you're seeing from the people that you all are giving a call to? Are you seeing a good response of people sharing that information, where they've been, who they've been talking with, or do you have any data on that?
We have, last week when we looked at those numbers, we had about 40 contacts that we were following through our program, which is probably far less than we should be. But we also have partnerships with the school to follow contacts. We have partnerships with ECU to follow student contacts, so they're helping with that. Internally, of those 40 contacts that Pitt County Health Department was following, we had contact with about 55% of those, or 22 individuals. So that's better than I've heard from some health directors. Some health directors have said that their no contact rate is as high as 80% with contacts. And we know both in terms of relaying results to testees or people, and then getting in touch with them from a contact tracing standpoint has been difficult, because people, everybody has caller ID now, or call block if they don't recognize the number. Many people don't answer that. People don't have voicemail set up, or their voicemail is full. It is a challenge. And then there are some folks who are simply reluctant to give up their case contacts. Folks that we test, we have results fairly quickly, so we feel if we get in touch with them, we can help intervene and reduce transmission in those settings. We're still in some of the commercial labs seeing several days turnaround time. So someone who's tested a week, can you remember who you might have been within 6 feet of a week ago? So it's in some cases it's hard to make those identifications as well.
And so what, are the challenges, and are you looking at any other ways to get in contact with people through contact tracing? I know obviously the best means has been through cell phone and calling people, but are there any other options you're looking at to kind of enhance and make those numbers greater as far as getting in contact with the people who may have had exposure to the virus?
Yeah, the state is rolling out an automated app that sits on both the Apple platform and the Google platform, or Android platform, that will allow my phone to exchange tokens with your phones if we're within 6 feet of each other anonymously, and then if I were to be identified as a positive, put that information into the app on my side. There would be an anonymous notification to people who my phone was within 6 feet of, who also had the app on their phone, that they had been within 6 feet of a confirmed case.
And just want to touch on one last thing. Vaccination, obviously we are several months into this, and is there a light at the end of the tunnel? Is there anything you can offer as far as the possibility of a vaccination, when they could roll that out potentially?
Yeah, first thing, let me say, if there's no reason you shouldn't get a flu shot, please get a flu shot this season. Those clinics will be coming in the near future through Pitt County Health Department, through a number of chain pharmacies, through Vidant Medical Group and Vidant Medical Center and Vidant Health in general. So please consider getting a flu shot if there's no reason that you shouldn't get a flu shot. As far as a coronavirus vaccine, we continue to receive hopeful news on that. There's some suggestion that a vaccine may be available in limited quantities by sometime in November. That distribution strategy will be determined from the feds to the federal government to the state government, and then down to us. We will get an allocation with instructions on which groups are prioritized for that early vaccine, and then as supplies become more widely available, the distribution of that will be broadened. And I would suspect, but I cannot confirm, that the distribution of this will sort of be top down, so that older, sicker people get vaccinated first, moving down to younger, healthier folks who are at lower risk. But that's a determination to be made by federal and state government at this time.
And just to wrap things up on my end, obviously we have seen the case numbers quite, fast. They've really kind of gone up and increased. And with ECU moving classes online here recently, do you think that the case numbers will kind of go back to where they were before the students came to campus, or what is kind of your insight on kind of the projections here on out?
Yeah, I think, Tyler, we need to ride this wave out, this bubble out. That will probably be something in the 2 to 4 incubation cycle range. And remember, an incubation cycle is 2 weeks, so 4 to 8 weeks to ride through this increase in cases brought on by the reopening of ECU. Not to throw them under the bus, this was not a local decision, this was a university system decision to reopen, and we worked very closely with them to be prepared for the reopening. Even being prepared, it was hard to control the spread in that age group and in that activities. So I suspect 4 to 8 weeks to ride through this bubble before we return to previous levels.
Thank you. That's it for me.
Okay, Elizabeth. Sorry, I'm not trying to forget you.
No, you're all good. So this is back to the playground thing. So of course kids are super little. What should they be doing if they're on playground? Should parents be making them wear a mask? What is proper protocol in order to prevent it?
Yeah, if the child can wear a mask and they're going to be within 6 feet of other children, it's probably reasonable to wear a mask. While playing on the playground, I wouldn't sanitize after every ride, but I would certainly sanitize before I went into the playground. So you start out with clean hands and sanitize when they're done playing on the playground. I would not snack or do other things in the playground that involved manipulations of the eyes, nose, or mouth without cleaning my hands first.
And of course crowding is very popular on playgrounds. So how can parents prevent that?
I don't think the jurisdictions are going to put monitors on the playground, so that's something that parents are going to have to self-monitor, and little kids are going to want to congregate and be with each other. So I think parents are going to have to monitor that in terms of trying to keep their child away from other children that aren't in the same family group.
And with gyms reopening, should people wear masks? What should people do?
I think the governor's order includes a thing about when you're lifting weights, you have to wear a mask. There's some concern that the forcible expiration while lifting weights may increase the spread of the virus or the distance the virus can travel. If you're within six feet of folks, if you're in the locker room, if the locker rooms are open, or checking in if you're less than 6 feet with people, which you shouldn't be in the first place, those would be good times to be masked. On the aerobic equipment, exercise treadmills, exercise bikes, those are supposed to be spaced out so that there should not be an issue with not having a mask on in those settings. But some of it depends on the physical plan of the gym too. So.
I have one additional question.
One follow-up.
So we've seen very few sparing, maybe like 2 to 3 cases of reinfection. Overseas and here in the United States. As a health professional, is that kind of the thing that scared you early on, that we were going to see kind of a second wave, that there might be another strain of COVID that could come through? Or does that concern you, or kind of what are your thoughts about the possibility of reinfection?
Yeah, I think the jury's still out on that. I mean, we know with SARS-1 and with MERS, which were both coronaviruses, there was some research done, and there were neutralizing antibodies present in those folks for at least 6 months. People have been looking for reinfection. If you look hard enough for it, you can find it. Even with things, I'm old enough that I actually had chickenpox. There are some folks who get reinfected with chickenpox, even though immunity is generally considered for life. So cases of reinfection probably do occur with this to some degree, but I think that's a small degree. We know that right now people probably have antibodies for at least 3 months. Studies are early. So if you've been infected now, you're probably going to have antibodies for at least 3 months after you clear the infection, and perhaps longer. Those who do become reinfected likely would have a very, very mild case because their immune system has already seen it, is already primed, and ready to attack that infection when it does enter the body. So it gives me some angst, but I think it's a minority of people, a very small group of people who would be subject to reinfection, at least early on after an active infection. But I think the data is still out there, and these sporadic reports of it are consistent with some of the things we've seen with other viral infections.
Thank you.
You're welcome.
And how does that happen? Would they have something? I know that it's not really known right now how someone would get reinfected, but would they have to have a super weak immune system? I know someone that had just recovered from coronavirus and had fears that they had caught it again because they were around a ton of people that had that coronavirus. What would that be?
Certainly people with compromised immune systems, they're sort of on their own island, so to speak, that they're a special group. They may not develop as sound of immunity to it as other groups, non-immunocompromised groups may. But I'm sorry, Elizabeth. So what would make somebody at risk for reinfection? Again, people who have a compromised immune system to begin with, and there are many, many medications that we use now to treat many autoimmune conditions and other conditions that are immune modulating, that weaken the immune system at some point to prevent the condition that they're designed to treat. So those may also lead to a less robust immune response to other infections. Does that make sense?
Yes.
So a number of the drugs that are out there that are for rheumatoid arthritis and Crohn's disease and things like that, many of these monoclonal antibody drugs that are immune modulating medications may affect an individual's response to coronavirus and may lead to a weaker immunity in those settings. Okay.